Question 1. The efficiency study reveals that a client with a history of myocardial infarction and physician clearance for moderate intensity exercise is progressing well and expresses a strong desire to accelerate their training program to achieve faster results. The MES is considering how to best respond to this client's request while ensuring their cardiovascular safety. Which of the following approaches best aligns with the MES's professional responsibilities and regulatory framework? Option A. Implement a gradual increase in exercise intensity and duration, incorporating regular monitoring of the client's cardiovascular response and seeking physician input if any concerns arise, or if the client's progress significantly deviates from the initial plan. Option B. Immediately increase the exercise intensity and duration to match the client's expressed desire for faster results, assuming their subjective feedback is the primary indicator of readiness. Option C. Advise the client that their desire for faster results cannot be accommodated due to their medical history and maintain the current exercise program without any adjustments. Option D. Suggest the client consult with a cardiologist for a new exercise stress test before any modifications to their current program are considered, even for minor adjustments. The correct answer is A. Implement a gradual increase in exercise intensity and duration, incorporating regular monitoring of the client's cardiovascular response and seeking physician input if any concerns arise, or if the client's progress significantly deviates from the initial plan. Explanation. This scenario presents a professional challenge because the medical exercise specialist, MES, must balance the client's desire for rapid progress with the inherent risks associated with cardiovascular disease. The MES must exercise sound professional judgment to ensure the client's safety and well-being, while still facilitating meaningful improvements in their health. This requires a thorough understanding of the client's specific condition, the potential contraindications for exercise, and the appropriate progression of exercise intensity and duration. The correct approach represents best professional practice because it prioritizes a comprehensive, individualized, and evidence-based strategy. This aligns with the core ethical and regulatory principles governing MES practice, which mandate client safety above all else. Specifically, it adheres to guidelines that require thorough client assessment, consideration of medical history and physician recommendations, and a gradual, monitored approach to exercise prescription for individuals with cardiovascular health considerations. This ensures that the exercise program is tailored to the client's current capacity and risk factors, minimizing the likelihood of adverse events and maximizing the potential for safe and effective rehabilitation. An incorrect approach that involves immediately increasing exercise intensity without further assessment or physician consultation would represent a significant regulatory and ethical failure. This would violate the principle of do no harm and could lead to serious adverse cardiovascular events, potentially resulting in legal liability and professional disciplinary action. Similarly, an approach that relies solely on the client's subjective feelings of exertion without objective measures or consideration of their underlying condition demonstrates a lack of due diligence and a failure to adhere to established best practices for managing clients with cardiovascular risks. This could be seen as negligence and a breach of professional standards. The professional decision-making process for similar situations should involve a systematic approach. 1. Thoroughly review the client's medical history, physician's clearance, and any specific recommendations or limitation. 2. Conduct a comprehensive initial assessment, including functional capacity tests and risk stratification, if appropriate and within the MES scope of practice. 3. Develop an individualized exercise program that gradually progresses in intensity, duration, and frequency, with clear monitoring parameters. 4. Regularly reassess the client's response to exercise and make necessary adjustments in consultation with the client, and if indicated, their physician. 5. Maintain clear and accurate documentation of all assessments, program modifications, and client responses. Question 2. Operational review demonstrates that a client with a diagnosed rotator cuff tear, currently undergoing a supervised medical exercise program, reports a significant increase in shoulder pain during a specific overhead press exercise, despite no apparent change in their form, the prescribed resistance. The MES is unsure if the pain is a normal response to exertion or an indication of a more serious issue requiring program alteration. Option A. Instruct the client to continue with the prescribed overhead press exercise, assuming the pain is a normal part of the rehabilitation process and will subside with continued effort. Option B. Independently modify the overhead press exercise by significantly reducing the range of motion and increasing the repetitions without consulting the referring healthcare provider. Option C. Consult with the client's referring physician or physical therapist to discuss the reported pain and seek guidance on appropriate modifications or cessation of the overhead press exercise. Option D. Immediately discontinue all upper body exercises and recommend complete rest for the client's shoulder until the pain resolves completely. The correct answer is C. Consult with the client's referring physician or physical therapist to discuss the reported pain and seek guidance on appropriate modifications or cessation of the overhead press exercise. Explanation: this scenario presents a professional challenge because the medical exercise specialist, MES, must balance the client's subjective report of pain with objective findings and established exercise guidelines for a specific musculoskeletal condition. The MES needs to make a critical decision regarding exercise modification or cessation, which directly impacts client safety and adherence to scope of practice. Careful judgment is required to avoid both undertreating the condition, leading to potential exacerbation, and overreacting, leading to unnecessary deconditioning or client frustration. The correct approach represents best professional practice because it prioritizes client safety and evidence-based intervention. By consulting the client's physician or physical therapist, the MES is adhering to the principle of interdisciplinary collaboration, a cornerstone of safe and effective medical exercise programming. This ensures that any exercise modifications are aligned with the overall treatment plan and are appropriate for the client's current stage of recovery and specific pathology. This aligns with the MES's ethical responsibility to practice within their scope and to seek guidance when necessary, preventing potential harm and ensuring the client receives the most appropriate care. Regulatory frameworks for MES typically emphasize the importance of working collaboratively with other healthcare professionals and respecting the boundaries of their expertise. An incorrect approach that involves continuing the prescribed exercise program without modification or further assessment fails to acknowledge the client's pain report. This could lead to an exacerbation of the musculoskeletal condition, violating the MES's duty of care and potentially leading to adverse events. Ethically, this demonstrates a disregard for the client's subjective experience and a failure to adapt the program to their needs. Another incorrect approach, such as immediately ceasing all exercise and recommending complete rest, might be an overreaction and could lead to deconditioning, muscle atrophy, and a loss of functional capacity. A rest can be appropriate in acute phases. Prolonged or unnecessary rest can be detrimental. This approach fails to consider the potential benefits of modified exercise and may not be supported by the client's physician or therapist. It also oversteps the MES's role by dictating a level of rest that should ideally be determined by a physician or physical therapist. A further incorrect approach, such as independently altering the exercise program significantly without consulting the client's physician or physical therapist, represents practicing outside the established scope of practice. While MES professionals are trained to modify exercises, significant changes for a client reporting pain related to a diagnosed musculoskeletal condition require input from the referring healthcare provider to ensure the modifications are medically sound and do not conflict with other treatment modalities. This could lead to inappropriate exercise prescription and potential harm. The professional decision-making process for similar situations should involve a systematic approach. 1. Acknowledge and validate the client's subjective report pain. 2. Review objective data, current exercise program, client's medical history, diagnosis. 3. Assess the immediate risk of continuing the current program. 4. Determine if the situation requires consultation with the referring physician or physical therapist. 5. If consultation is needed, clearly communicate the client's symptoms and the current exercise context. 6. Implement appropriate modifications or cessation based on the guidance received and the MES's scope of practice. 7. Document all assessments, communications, and program changes. Question 3. The evaluation methodology shows a client presenting with intermittent, mild tremors in their dominant hand during functional movement assessments, alongside a reported history of occasional, transient numbness in the same limb. The MES has completed a thorough musculoskeletal assessment and has no immediate concerns regarding strength, range of motion, or pain related to exercise. However, the observed tremors and reported paresthesia are new observations not previously documented. What is the most appropriate course of action for the medical exercise specialist? Option A. Attempt to identify the specific nerve impingement or neurological pathway involved through specialized manual techniques and design an exercise protocol to address it. Option B. Document the observations and continue with the planned exercise program, monitoring for any changes in the tremors or numbness. Option C. Recommend immediate cessation of all exercise and refer the client to their primary care physician for a neurological evaluation. Option D. Advise the client that these symptoms are likely stress-related and suggest relaxation techniques as part of the exercise program. The correct answer is C. Recommend immediate cessation of all exercise and refer the client to their primary care physician for a neurological evaluation. Explanation. This scenario presents a professional challenge due to the inherent complexity of the nervous system and the potential for misinterpretation of subtle neurological signs. A medical exercise specialist, MES, must exercise extreme caution and adhere strictly to their scope of practice, which involves exercise programming and not medical diagnosis or treatment. The primary ethical and regulatory imperative is to ensure client safety and to operate within the boundaries of their professional qualifications. The correct approach represents best professional practice because it prioritizes client safety and adheres to the MES scope of practice. By recommending a referral to a qualified medical professional for further assessment, the MES is acting ethically and responsibly. This aligns with regulatory frameworks that mandate MES professionals to recognize the limits of their expertise and to seek appropriate medical consultation when client conditions fall outside their purview. This action upholds the principle of do no harm and ensures the client receives the necessary medical attention from a physician or neurologist. An incorrect approach that involves attempting to diagnose the cause of the observed symptoms or prescribing specific exercises to treat the neurological signs would represent a significant regulatory and ethical failure. This constitutes practicing medicine without a license, a direct violation of medical practice acts and professional conduct guidelines. It also exposes the client to potential harm if the underlying condition is serious and not properly managed by a medical doctor. Furthermore, it breaches the trust placed in the MES by the client and the healthcare community. Another incorrect approach, such as ignoring the observed symptoms and proceeding with a standard exercise program, demonstrates negligence and a failure to uphold the duty of care owed to the client. This could lead to adverse events and liability for the MES. Professional decision-making in such situations requires a systematic approach. 1. Recognize and document any observed signs or symptoms that appear outside the norm for exercise participation. 2. Assess the potential implications of these findings within the context of exercise safety. 3. If there is any doubt or concern regarding the client's medical status, err on the side of caution. 4. Communicate findings clearly and professionally to the client, explaining the need for medical evaluation without attempting to diagnose. 5. Facilitate a referral to an appropriate medical professional. 6. Document all actions taken and communications. Question 4. Investigation of a new client with a history of stable angina pectoris reveals they are eager to begin a supervised exercise program to improve their cardiovascular health and functional capacity. The client states they feel pretty good and have not experienced any chest pain in several weeks. They have not seen their cardiologist for a routine checkup in over a year. As a medical exercise specialist, what is the most appropriate initial course of action? Option A. Obtain written medical clearance from the client's cardiologist, including any specific exercise recommendations or contraindications, before initiating any exercise program. Option B. Advise the client to schedule a follow-up appointment with their cardiologist and then proceed with a high-intensity interval training program to maximize cardiovascular benefits. Option C. Begin a moderate-intensity exercise program based on the client's self-reported feeling of well-being and general guidelines for cardiovascular health. Option D. Start a low-intensity exercise program focusing on flexibility and light aerobic activity, and monitor the client closely for any signs of discomfort. The correct answer is A. Obtain written medical clearance from the client's cardiologist, including any specific exercise recommendations or contraindications, before initiating any exercise program. Explanation: scenario analysis. This scenario presents a common challenge for medical exercise specialists, MES, involving a client with a known cardiovascular condition. The primary challenge lies in balancing the client's desire for improved fitness with the inherent risks associated with their pre-existing condition. The MES must exercise sound professional judgment to ensure the client's safety while effectively addressing their goals. This requires a thorough understanding of the client's medical history, current status, and the potential impact of exercise on their cardiovascular system. Correct approach analysis. The correct approach prioritizes client safety and adherence to established medical guidelines. Obtaining a physician's clearance is paramount when working with individuals who have cardiovascular disease. This clearance ensures that the physician, who has the most comprehensive understanding of the client's specific condition, has deemed exercise safe and has provided any necessary parameters or contraindications. This aligns with the MES's ethical responsibility to practice within their scope of competence and to avoid causing harm. Furthermore, it demonstrates a commitment to collaborative care, integrating exercise programming with the client's overall medical management. Incorrect approaches analysis. One incorrect approach involves proceeding with an exercise program without physician clearance. This is a significant ethical and potentially regulatory failure. It bypasses the essential medical oversight required for individuals with cardiovascular conditions, placing the client at undue risk of adverse cardiovascular events. This action violates the principle of do no harm and demonstrates a lack of professional diligence. Another incorrect approach is to rely solely on the client's self-reported feelings of well-being to guide exercise intensity. While subjective feedback is important, it is insufficient for individuals with cardiovascular disease. Their perception of exertion may not accurately reflect their physiological response to exercise, and they may not recognize early warning signs of cardiac distress. This approach neglects the objective medical data and professional assessment necessary for safe exercise prescription. A further incorrect approach is to implement a generic, high-intensity exercise program without considering the client's specific diagnosis and limitations. Cardiovascular conditions vary widely in severity and type. A one-size-fits-all approach ignores the individualized nature of exercise prescription and the need to tailor programs to the client's unique physiological profile and medical recommendations. This can lead to overexertion, exacerbation of symptoms, or other adverse outcomes. Professional reasoning. When faced with a client who has a cardiovascular condition, the MES should follow a structured decision-making process. This begins with a comprehensive client assessment, including a detailed review of their medical history and any physician's notes. The next critical step is to obtain explicit medical clearance from their physician, ensuring any specific recommendations or limitations are understood. Based on this clearance and the client's goals, the MES then develops an individualized, progressive exercise program. Throughout the program, continuous monitoring of the client's response to exercise, including subjective and objective measures, is essential. Regular communication with the client and their physician is also vital for ongoing safety and program adjustment. Question 5. What factors determine the appropriate exercise modifications and progression for a client experiencing symptoms of peripheral neuropathy, considering the interplay between the central and peripheral nervous systems? Option A. General exercise guidelines for cardiovascular health and muscular strength, assuming the nervous system's role is secondary. Option B. The client's ability to perform complex motor tasks without any reported discomfort, regardless of underlying neurological status. Option C. The client's reported sensory deficits, balance impairments, and physician's recommendations regarding exercise intensity and type. Option D. The MES's personal experience with clients who have had similar symptoms, without consulting medical records. The correct answer is C. The client's reported sensory deficits, balance impairments, and physician's recommendations regarding exercise intensity and type. Explanation. Scenario analysis. A medical exercise specialist, MES, is tasked with designing an exercise program for a client experiencing symptoms suggestive of peripheral neuropathy. The challenge lies in accurately assessing the client's functional limitations and potential contraindications stemming from the nervous system's involvement, without overstepping the scope of practice. Misinterpreting neurological signs or applying inappropriate exercise interventions could exacerbate the condition or lead to injury. highlighting the critical need for a thorough understanding of central and peripheral nervous system functions in relation to exercise. Correct approach analysis. The correct approach involves a comprehensive assessment that integrates information from the client's medical history, physician's recommendations, and direct observation of neurological signs and symptoms during functional movements. This aligns with the MES's role to work collaboratively with healthcare providers and to apply exercise science principles to individuals with medical conditions. The MES must understand how central and peripheral nervous system dysfunctions manifest in motor control, sensation, and proprioception to safely and effectively tailor an exercise program. This approach prioritizes client safety and adherence to the scope of practice by focusing on exercise modification and progression based on observed responses and established medical guidance. Incorrect approaches analysis. One incorrect approach would be to solely rely on general exercise guidelines for healthy individuals, disregarding the client's specific neurological condition. This fails to acknowledge the unique physiological responses and potential risks associated with nervous system impairment, violating the ethical obligation to provide individualized care and potentially leading to adverse events. Another incorrect approach would be to attempt to diagnose the specific neurological condition or prescribe treatments beyond the scope of exercise prescription. This oversteps the MES's professional boundaries and could interfere with the client's medical management, posing a significant ethical and potentially legal risk. A third incorrect approach would be to ignore or downplay the client's reported neurological symptoms, proceeding with a standard exercise protocol. This demonstrates a lack of due diligence and a failure to appreciate the impact of neurological dysfunction on exercise capacity and safety, thereby compromising the client's well-being. Professional reasoning. Professionals should employ a systematic decision-making process that begins with gathering comprehensive client information, including medical history and physician clearance. This is followed by a thorough assessment of the client's current functional status, paying close attention to any reported or observed neurological deficits. The MES then synthesizes this information to identify potential exercise contraindications and necessary modifications. Collaboration with the client's physician or other healthcare providers is crucial for clarifying the nature of the condition and any specific exercise recommendations or precautions. Finally, the exercise program is designed and implemented with continuous monitoring of the client's response, allowing for ongoing adjustments to ensure safety and efficacy. Question 6. When evaluating a client's response to a new resistance training program designed to improve shoulder joint mobility and stability, the client reports experiencing a dull ache and a feeling of stiffness in the shoulder joint approximately 24 hours after the initial session. The MES observes no visible signs of inflammation or swelling, and the client's active range of motion appears largely unchanged from baseline during the assessment conducted immediately prior to the next session. Considering the viscoelastic properties of connective tissues like tendons and ligaments, which of the following represents the most appropriate initial course of action for the medical exercise specialist? Option A. Suggest the client rest the shoulder completely for several days and avoid all upper body exercises until the symptoms completely resolve, as this indicates a potential injury. Option B. Recommend a period of reduced intensity and volume for the shoulder exercises in the next session, focusing on controlled movements and monitoring the client's subjective feedback closely, while also considering the potential for delayed onset muscle soreness and tissue adaptation. Option C. Recommend the client consult with a physician for a diagnostic imaging scan to rule out any underlying structural damage to the shoulder joint. Option D. Advise the client that the reported ache and stiffness are normal responses to exercise and instruct them to proceed with the original program intensity and volume as planned, assuming it is simply muscle soreness. The correct answer is B. Recommend a period of reduced intensity and volume for the shoulder exercises in the next session, focusing on controlled movements and monitoring the client's subjective feedback closely, while also considering the potential for delayed onset muscle soreness and tissue adaptation. Explanation. This scenario presents a professional challenge because the medical exercise specialist, MES, must interpret subjective client feedback regarding connective tissue response within the context of objective physiological principles and established safety guidelines. The MES needs to differentiate between normal adaptive responses to exercise and signs of potential injury or overstress, which requires a nuanced understanding of connective tissue properties like viscoelasticity and creep. The correct approach represents best professional practice because it prioritizes a systematic, evidence-based assessment. By considering the client's subjective experience, pain, stiffness, alongside objective measures, range of motion, palpation, functional movement patterns, the MES can form a comprehensive picture. This aligns with the ethical obligation to provide safe and effective exercise programming, minimizing risk of harm and maximizing therapeutic benefit. Adhering to established protocols for assessing and modifying exercise based on client response is fundamental to the MES scope of practice and regulatory expectations for client care. An incorrect approach that relies solely on the client's subjective report without objective corroboration fails to meet professional standards. It risks either undertreating a condition that requires careful management or overreacting to transient discomfort that is a normal part of tissue adaptation. This could lead to suboptimal outcomes or even iatrogenic injury, violating the duty of care. Another incorrect approach that ignores the client's subjective feedback and proceeds with the planned intensity, assuming objective measures are sufficient, is also professionally unacceptable. Connective tissues can exhibit delayed responses or pain that is not immediately apparent through standard objective assessments. Disregarding client-reported symptoms can lead to exceeding tissue tolerance, causing microtrauma or exacerbating existing conditions, which is a direct contravention of safe exercise practice principles. A further incorrect approach that involves making definitive medical diagnoses or prescribing specific medical interventions beyond the scope of practice for an MES is a critical regulatory and ethical failure. MES professionals are trained to design and implement exercise programs, not to diagnose or treat medical conditions. This overreach can lead to misdiagnosis, delayed appropriate medical care, and potential harm to the client, and it violates the boundaries of the MES professional role. The professional decision-making process for similar situations should involve a continuous feedback loop. This includes 1. Thorough initial assessment, 2. Careful monitoring during exercise session, 3. Active listening to client feedback, 4. Objective reassessment, 5. Evidence-based interpretation of findings, and 6. Appropriate modification of the exercise program or referral to a medical professional when indicated. This iterative process ensures client safety and optimizes therapeutic outcomes. Question 7. Quality control measures reveal that during a routine medical exercise session, a client's blood pressure reading is significantly higher than their established baseline and exceeds the threshold for safe exercise intensity according to current guidelines. The client reports feeling no immediate discomfort. What is the most appropriate course of action for the medical exercise specialist? Option A. Immediately modify the planned exercise intensity to a lower level and continue the session, closely monitoring the client's response. Option B. Terminate the exercise session immediately and instruct the client to go to the nearest emergency room for evaluation. Option C. Proceed with the originally planned exercise intensity, assuming the elevated reading is a temporary anomaly unrelated to the exercise. Option D. Advise the client to rest for a few minutes, remeasure their blood pressure, and if it remains elevated, consult their physician for guidance before proceeding with any exercise. Correct answer is A. Immediately modify the planned exercise intensity to a lower level and continue the session, closely monitoring the client's response. Explanation. Scenario analysis. This scenario presents a common challenge for medical exercise specialists, MES, where a client's physiological response to exercise, specifically blood pressure, deviates from expected norms. The challenge lies in accurately interpreting this deviation within the scope of practice, ensuring client safety, and making appropriate professional decisions without overstepping boundaries into medical diagnosis or treatment. The MES must balance the benefits of exercise with the potential risks associated with uncontrolled hypertension. Correct approach analysis. The correct approach demonstrates adherence to professional scope of practice and client safety protocols. By recognizing the elevated blood pressure reading as a potential contraindication for the planned exercise intensity and consulting the client's physician, the MES acts responsibly. This aligns with regulatory frameworks that mandate MES to operate within their defined competencies and to refer clients to appropriate medical professionals when their condition warrants it. This proactive consultation ensures the client receives medical clearance and guidance, safeguarding their health and maintaining professional integrity. It also upholds ethical principles of beneficence and non-maleficence. Incorrect approaches analysis. One incorrect approach involves proceeding with the planned exercise intensity despite the elevated blood pressure. This is a significant regulatory and ethical failure. It disregards established guidelines for exercise prescription in individuals with hypertension, potentially exacerbating the condition and leading to adverse cardiovascular events. This action constitutes practicing outside the scope of the MES role, which does not include managing or treating medical conditions like uncontrolled hypertension. Another incorrect approach is to immediately terminate the exercise session and advise the client to seek immediate medical attention without further assessment or context. While safety is paramount, an overly cautious or alarmist response without considering the client's history or the specific reading can cause unnecessary anxiety and may not be the most appropriate course of action for a single elevated reading. The MES should have a protocol for managing such situations, which may involve a brief rest period and remeasurement before escalating to a physician referral, unless the reading is critically high. This approach fails to demonstrate nuanced professional judgment. A further incorrect approach is to ignore the elevated reading and continue with the session as planned, assuming it is a temporary anomaly. This is a critical failure in client monitoring and risk management. It demonstrates a lack of understanding of the importance of blood pressure regulation during exercise and the potential dangers of exercising with uncontrolled hypertension. This negligence can have severe health consequences for the client and exposes the MES to professional liability. Professional reasoning. When faced with a client's elevated blood pressure during an exercise session, the MES should follow a structured decision-making process. This involves 1. Accurate measurement and verification of the reading. 2. Consideration of the client's medical history and current medications. 3. Assessment of any symptoms the client may be experiencing. 4. Comparison of the reading against established guidelines for exercise contraindications. 5. If the reading exceeds safe limits or is significantly elevated beyond the client's baseline, the MES must exercise caution, potentially modifying the exercise intensity or duration or postponing the session. 6. Crucially, if the reading indicates a potential health risk, the MES must consult with the client's physician for clearance and specific guidance before proceeding with exercise. This systematic approach ensures client safety, upholds professional standards, and adheres to regulatory requirements. Question 8. The efficiency study reveals that a client exhibits a reduced rate of acetylcholine release at the neuromuscular junction during sustained submaximal contractions. Which of the following exercise prescription adjustments would best align with established principles of neuromuscular physiology and best professional practice for a medical exercise specialist? Option A. Recommend a significant increase in eccentric loading to challenge the muscle fibers beyond their current capacity. Option B. Increase the frequency of high-intensity interval training sessions to stimulate greater motor unit recruitment. Option C. Incorporate exercises that focus on improving the efficiency of motor unit firing patterns and enhancing neuromuscular coordination through controlled, deliberate movements. Option D. Introduce plyometric exercises to enhance the speed of muscle fiber depolarization and repolarization. The correct answer is B. Increase the frequency of high-intensity interval training sessions to stimulate greater motor unit recruitment. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires the medical exercise specialist, MES, to interpret findings related to neuromuscular function and muscle contraction in the context of a client's exercise program. The MES must ensure that their recommendations are not only effective for improving performance, but also safe and compliant with established professional standards and any applicable regulatory guidelines for exercise prescription. The challenge lies in translating physiological understanding into practical, evidence-based, and ethically sound exercise interventions, particularly when dealing with potential limitations or dysfunctions at the neuromuscular junction. Correct approach analysis. The correct approach involves a thorough understanding of the neuromuscular junction's role in initiating and sustaining muscle contraction, and how this knowledge directly informs exercise selection and progression. Best professional practice dictates that an MES should consider how factors affecting neurotransmitter release, receptor binding, and subsequent muscle fiber activation can be influenced by exercise. This includes recognizing that certain exercise modalities or intensities might exacerbate or ameliorate issues at the neuromuscular junction. The MES must base their exercise prescription on established principles of exercise physiology and kinesiology, ensuring that the program is tailored to the individual's needs and goals while adhering to the scope of practice for a medical exercise specialist. This approach is ethically sound, as it prioritizes client safety and efficacy based on scientific principles. Incorrect approaches analysis. An incorrect approach would be to recommend exercises that are not supported by an understanding of neuromuscular function, or that could potentially compromise the neuromuscular junction's integrity. For instance, recommending high-intensity, explosive movements without considering the client's current neuromuscular capacity could lead to fatigue, impaired motor unit recruitment, or even injury, all of which stem from a misunderstanding of how the neuromuscular system responds to stress. Another incorrect approach would be to deviate from evidence-based exercise principles and rely solely on anecdotal evidence or unverified training techniques. This would be professionally unacceptable, as it fails to uphold the standard of care expected of a MES and could lead to ineffective or harmful interventions. Furthermore, any approach that oversteps the scope of practice for an MES, such as diagnosing or treating underlying neurological conditions, would be a significant regulatory and ethical failure. Professional reasoning. MES professionals should employ a systematic decision-making process. This begins with a comprehensive client assessment, including understanding their medical history, current functional status, and specific exercise goals. The MES then applies their knowledge of exercise physiology, including the principles of neuromuscular function and muscle contraction, to design a program. This program should be progressive, individualized, and evidence-based. Regular reassessment and program modification are crucial to ensure continued safety and effectiveness. When faced with complex physiological findings, the MES should consult relevant literature, collaborate with other healthcare professionals if necessary, and always prioritize the client's well-being within the established scope of practice and regulatory framework. Question 9. The control framework reveals that a client presents with noticeable unsteadiness during balance exercises, occasional hand tremors when reaching for objects, and reports subjective feelings of pins and needles in their extremities during prolonged static postures. The medical exercise specialist, MES, is tasked with designing an exercise program to improve overall functional capacity. Considering the MES's scope of practice and the potential implications of these findings on exercise performance and safety, which of the following actions best reflects appropriate professional conduct? Option A. Proceed with a general exercise program focusing on strength and endurance, assuming the symptoms are temporary and will resolve with increased physical activity. Option B. Advise the client that these symptoms are likely due to anxiety and suggest relaxation techniques as part of the exercise regimen. Option C. Design a specialized exercise program that specifically targets the observed tremors and unsteadiness, incorporating proprioceptive drills and fine motor skill exercises. Option D. Immediately refer the client to a physician for a comprehensive neurological evaluation, explaining that these symptoms require medical assessment before an exercise program can be safely implemented. The correct answer is D. Immediately refer the client to a physician for a comprehensive neurological evaluation, explaining that these symptoms require medical assessment before an exercise program can be safely implemented. Explanation. Scenario analysis. This scenario presents a common challenge for medical exercise specialists, MES, where a client exhibits symptoms that could be indicative of a neurological condition impacting exercise performance. The professional challenge lies in accurately assessing the client's capabilities and limitations without overstepping the scope of practice for an MES, which is to design and implement exercise programs for individuals with medical conditions. Misinterpreting neurological signs could lead to inappropriate exercise prescription, potentially exacerbating the condition or causing harm. The MES must balance the need to provide effective exercise guidance with the imperative to recognize when medical referral is necessary. Correct approach analysis. The correct approach involves a comprehensive assessment that specifically probes for neurological signs and symptoms related to motor control, coordination, and balance. This includes observing gait, assessing proprioception, and evaluating reaction times. If these assessments reveal deviations from expected norms that are consistent with potential neurological dysfunction, the MES must refer the client to a physician or neurologist for a definitive diagnosis and medical management plan. This aligns with the MES scope of practice, which emphasizes working collaboratively with the healthcare team and prioritizing client safety. The MES's role is to adapt exercise programs based on medical clearance and recommendations, not to diagnose or treat underlying neurological diseases. This approach upholds ethical responsibilities to act in the client's best interest and within professional boundaries. Incorrect approach is analysis. One incorrect approach would be to proceed with a standard exercise program without further investigation, assuming the observed symptoms are simply due to deconditioning or fatigue. This fails to acknowledge the potential seriousness of neurological signs and could lead to an unsafe exercise prescription, potentially worsening the client's condition or causing injury. This violates the ethical principle of non-maleficence, do no harm, and demonstrates a lack of due diligence in client assessment. Another incorrect approach would be to attempt to diagnose the neurological condition or prescribe specific interventions aimed at treating the suspected neurological issue. This directly exceeds the MES scope of practice and encroaches upon the domain of licensed medical professionals. Such an action is both unethical and potentially illegal, as it constitutes the unauthorized practice of medicine. A third incorrect approach would be to dismiss the client's symptoms entirely, attributing them to psychological factors or minor complaints without adequate objective assessment. This demonstrates a lack of professional responsibility and could lead to a misdiagnosis of a significant medical condition, delaying necessary treatment and negatively impacting the client's health outcomes. Professional reasoning. When faced with a client exhibiting signs potentially related to the nervous system's role in exercise performance, the MES should employ a systematic decision-making process. This begins with a thorough initial assessment, including a detailed health history and observation of functional movements. If any red flags suggestive of neurological impairment are identified, e.g., unsteadiness, tremors, coordination difficulties, sensory changes, the MES must pause the exercise prescription process. The next critical step is to consult with the client about these observations and strongly recommend a medical evaluation by a physician. The MES should document all observations and the recommendation for medical referral. Upon receiving medical clearance and specific exercise guidelines from the physician, the MES can then design or modify an exercise program that is safe and effective for the client's condition. This collaborative approach ensures client safety, adheres to professional boundaries, and optimizes exercise outcomes within the established medical framework. Question 10. System analysis indicates a medical exercise specialist, MES, is working with a client who reports experiencing significant shortness of breath during a moderate-intensity aerobic exercise session. The client also appears to be using accessory muscles to breathe, and their respiratory rate has increased noticeably. The MES needs to determine the most appropriate immediate course of action. Option A. Immediately instruct the client to stop all exercise and advise them to go to the nearest emergency room for an immediate medical assessment. Option B. Pause the exercise, assess the client's symptoms and vital signs, and if symptoms persist or are severe, refer the client to their physician for further evaluation. Option C. Continue the exercise at a slightly lower intensity, assuming the shortness of breath is a normal adaptation to increased exertion. Option D. Provide the client with specific breathing techniques and exercises to manage their shortness of breath during the remainder of the session. The correct answer is B. Pause the exercise, assess the client's symptoms and vital signs, and if symptoms persist or are severe, refer the client to their physician for further evaluation. Explanation. Scenario analysis. This scenario presents a common challenge for medical exercise specialists, MES, where a client exhibits symptoms that could be indicative of underlying respiratory compromise during exercise. The professional challenge lies in accurately assessing the situation, differentiating between normal exercise-induced physiological responses and potential pathological conditions, and intervening appropriately without overstepping the scope of practice. The MES must balance the need to facilitate safe and effective exercise with the imperative to recognize and refer potential medical issues. Correct approach analysis. The correct approach involves recognizing the client's subjective report of shortness of breath and objective signs of distress, such as increased respiratory rate and accessory muscle use. This necessitates a pause in exercise to allow for recovery and further assessment. The MES should then inquire about the onset, duration, and severity of the symptoms, and observe for any accompanying signs like cyanosis or dizziness. If symptoms persist or are severe, the MES must exercise professional judgment and refer the client to their physician for further medical evaluation. This aligns with the MES scope of practice, which emphasizes safe exercise programming and recognizing when medical intervention is required. Ethical practice dictates prioritizing client safety and avoiding the provision of medical advice or diagnosis. Incorrect approach is analysis. One incorrect approach is to dismiss the client's reported shortness of breath as a normal physiological response to exercise and continue with the prescribed intensity. This fails to acknowledge the client's subjective experience and potential warning signs of respiratory distress, potentially exacerbating an underlying condition and violating the ethical duty of care. It also demonstrates a lack of critical assessment skill, a failure to adhere to best practices in exercise prescription for individuals with potential health concerns, and a disregard for the principle of do no harm. Another incorrect approach is to immediately cease exercise and advise the client to seek immediate medical attention without attempting a brief, non-invasive assessment of the symptoms. A referral is crucial if symptoms are severe or persistent. A brief pause and targeted questioning can help differentiate between transient exercise intolerance and a more serious issue, allowing for a more informed referral. This approach might be overly cautious to the point of unnecessary alarm and could undermine the client's confidence in their ability to exercise, without necessarily providing more immediate benefit than a structured assessment and appropriate referral. A third incorrect approach is to attempt to diagnose the cause of the shortness of breath or prescribe specific breathing exercises or interventions to alleviate it. This directly crosses the boundary of the MES scope of practice, which prohibits medical diagnosis and treatment. Such actions could lead to misdiagnosis, delayed appropriate medical care, and potential harm to the client, representing a significant ethical and professional failure. Professional reasoning. When faced with a client experiencing shortness of breath during exercise, the MES should follow a structured decision-making process. First, prioritize immediate safety by pausing the exercise. Second, conduct a brief, non-diagnostic assessment, including subjective questioning and objective observation. Third, based on the assessment, determine the appropriate course of action. If symptoms are mild and resolve quickly with rest, continue exercise at a reduced intensity with close monitoring. If symptoms are moderate, persistent, or accompanied by other concerning signs, refer the client to their physician for evaluation. If symptoms are severe or life-threatening, call for emergency medical services. Throughout this process, the MES must maintain clear communication with the client and document all observations and actions taken. Question 11. The risk matrix shows a moderate likelihood of a client experiencing significant fatigue and reduced force production during a sustained submaximal exercise bout, accompanied by a burning sensation in the working muscles. Which primary mechanism of muscle contraction and fatigue best explains this client's experience and informs appropriate program adjustments? Option A. The fundamental process of actin and myosin filaments sliding past each other, which is inherently limited in its capacity to sustain prolonged effort. Option B. The depletion of readily available energy substrates, ATP and phosphocreatine, and the accumulation of metabolic byproducts, e.g., inorganic phosphate hydrogen ions, interfering with cross-bridge cycling and calcium release. Option C. A general lack of muscular strength, indicating insufficient motor unit activation and force-generating capacity. Option D. A primary decrease in the central nervous system's ability to recruit motor units, leading to reduced neural drive to the muscles. Correct answer is B. The depletion of readily available energy substrates, ATP and phosphocreatine, and the accumulation of metabolic byproducts, e.g., inorganic phosphate hydrogen ions, interfering with cross-bridge cycling and calcium release. Explanation. Scenario analysis. This scenario presents a challenge in applying foundational physiological knowledge to a practical client scenario, emphasizing the importance of accurate client assessment and program design. The MES must discern the most relevant mechanism of muscle contraction to explain a client's specific exercise response, ensuring clear and safe communication. Misunderstanding or misapplying. these mechanisms can lead to ineffective exercise prescription, potential client frustration, or even injury if the underlying cause of a client's experience is misinterpreted. Correct approach analysis. The correct approach involves identifying the primary mechanism of muscle contraction that best explains the client's reported sensation of fatigue and reduced force production during a sustained, submaximal effort. This aligns with best professional practice by demonstrating a thorough understanding of exercise physiology and its application to client care. Specifically, focusing on the depletion of readily available energy substrates like ATP and phosphocreatine, and the accumulation of metabolic byproducts such as inorganic phosphate and hydrogen ions, directly addresses the physiological fatigue experienced during prolonged exertion. This understanding allows for informed program modifications, such as adjusting exercise duration, intensity, or rest periods, and educating the client on the physiological basis of their experience, thereby fostering trust and adherence. This approach is ethically sound as it prioritizes client understanding and safety based on scientific principles. Incorrect approach is analysis. One incorrect approach would be to solely attribute the client's experience to a lack of muscular strength. While strength is a factor in overall performance, it does not fully explain the progressive fatigue and reduced force output during a sustained effort. This is a failure to apply a nuanced understanding of fatigue mechanisms, potentially leading to an inappropriate training prescription that focuses solely on increasing maximal strength rather than addressing the metabolic and neural factors contributing to endurance fatigue. Ethically, this could be seen as providing incomplete or misleading information to the client. Another incorrect approach would be to focus on the sliding filament theory as the primary explanation for fatigue in this context. While the sliding filament theory, actin and myosin crossbridge cycling, is fundamental to muscle contraction, it doesn't directly explain the cessation or significant reduction of force production due to fatigue during sustained submaximal exercise. Fatigue is more directly linked to the availability of energy to power this cycling, and the accumulation of metabolites that interfere with the process, rather than the fundamental mechanism of filament interaction itself. This approach demonstrates a superficial understanding of fatigue, potentially leading to an ineffective intervention. A further incorrect approach would be to emphasize the role of the nervous system's central fatigue mechanisms without considering the peripheral factors. While central fatigue, reduced motor unit recruitment or firing frequency, can contribute, the client's description of a burning sensation and inability to maintain effort strongly suggests peripheral fatigue involving intramuscular changes. Overemphasizing central fatigue without acknowledging peripheral mechanisms would lead to an incomplete assessment and potentially misdirected training strategies. This represents a failure to conduct a comprehensive physiological assessment. Professional reasoning. When faced with a client reporting specific exercise sensations, a medical exercise specialist should employ a systematic reasoning process. First, actively listen to and accurately interpret the client's subjective experience. Second, connect these subjective reports to established physiological principles, considering various potential mechanisms. Third, differentiate between primary and secondary contributing factors. Fourth, use this integrated understanding to inform exercise prescription and client education. Finally, continuously reassess the client's response to intervention, adapting the plan as needed. This iterative process ensures that interventions are evidence-based, client-centered, and ethically sound, prioritizing safety and efficacy. Question 12. The audit findings indicate that a medical exercise specialist, MES, has been consistently programming high-intensity interval training, HIIT, for a client with a history of chronic fatigue syndrome, despite the client expressing concerns about post-exercise exhaustion and muscle soreness that lasts for several days. The MES has justified this approach by stating the client's desire for faster progress and the perceived effectiveness of HIIT for general fitness. Considering the principles of muscle physiology and the MES's ethical obligations, which of the following represents the most appropriate course of action for the MES? Option A. Advise the client to consult a physician for pain management and continue the HIIT program as prescribed, as the MES's role is solely exercise prescription and not medical treatment. Option B. Immediately discontinue HIIT and reassess the client's physiological response to exercise, focusing on lower intensity, longer duration activities that promote aerobic conditioning and recovery, while educating the client on the physiological implications of overexertion for individuals with chronic fatigue syndrome. Option C. Continue with the current HIIT program, as the client has expressed a desire for faster progress, and the MES believes it is generally effective for fitness, assuming the client will eventually adapt. Option D. Introduce even more advanced HIIT protocols with shorter rest periods to further challenge the client's muscles and potentially accelerate adaptation, despite the client's reported symptoms. The correct answer is B. Immediately discontinue HIIT and reassess the client's physiological response to exercise, focusing on lower intensity, longer duration activities that promote aerobic conditioning and recovery, while educating the client on the physiological implications of overexertion for individuals with chronic fatigue syndrome. Explanation: this scenario presents a professional challenge because it requires the medical exercise specialist, MES, to balance client autonomy and the desire for rapid progress with the fundamental principles of muscle physiology and the ethical obligation to provide safe and effective exercise programming. The audit findings highlight a potential deviation from best practices, necessitating a careful review of the MES's decision-making process. The correct approach prioritizes a thorough understanding of muscle physiology, specifically the concept of muscle adaptation, and the risks associated with overtraining or inappropriate exercise selection. It emphasizes a client-centered approach that respects the client's goals while ensuring the program is physiologically sound and minimizes the risk of injury or adverse effects. This aligns with the MES's ethical responsibility to act in the best interest of the client, adhering to established scientific principles and professional guidelines that govern the practice of medical exercise. The MES must ensure that exercise prescriptions are evidence-based and tailored to the individual's current physiological state, progression capabilities, and any underlying medical conditions. An incorrect approach that focuses solely on the client's stated desire for rapid results without adequate physiological consideration fails to uphold the MES's duty of care. This could lead to overexertion, muscle damage, or other adverse physiological responses, potentially exacerbating existing conditions or creating new ones. Such an approach disregards the scientific basis of exercise prescription and the importance of gradual, progressive overload. Another incorrect approach that involves implementing advanced or high-intensity exercises without a proper assessment of the client's current muscle function, endurance, and recovery capacity is also professionally unacceptable. This demonstrates a lack of understanding of muscle physiology and the principles of safe progression. It prioritizes perceived intensity over physiological readiness, increasing the risk of injury and undermining the long-term effectiveness of the exercise program. A further incorrect approach that involves deviating from established protocols or guidelines without a clear, evidence-based rationale, even if presented as a novel or innovative method, is problematic. While innovation is valued, it must be grounded in scientific understanding and safety. Without this, such deviations can be seen as reckless and unprofessional, potentially leading to negative outcomes for the client and a breach of professional standards. The professional decision-making process for similar situations should involve a systematic evaluation of the client's goals in conjunction with their current physiological status. This includes a comprehensive assessment of muscle strength, endurance, flexibility, and any limitations imposed by medical conditions. The MES must then apply their knowledge of muscle physiology to design a program that promotes safe and effective adaptation, incorporating principles of progressive overload, specificity, and recovery. Open communication with the client regarding the rationale behind the program design, potential risks, and expected outcomes is crucial for fostering trust and ensuring adherence. When faced with a client's strong desire for rapid progress, the MES must educate them on the physiological realities of adaptation and the importance of a sustainable, safe approach, rather than compromising on best practices. Question 13. The efficiency study reveals that a client with a history of chronic obstructive pulmonary disease, COPD, exhibits reduced lung capacity and increased resistance to airflow during breathing. Considering the anatomy of the respiratory tract, which of the following approaches best informs the design of a safe and effective medical exercise program for this individual? Option A. Implementing a high-intensity interval training program to improve overall cardiovascular conditioning, assuming that improved circulation will indirectly benefit respiratory function. Option B. recommending a program focused solely on upper body strength training, as this is less likely to significantly impact respiratory effort. Option C, suggesting that the client focus on pursed lip breathing techniques during all activities, without specific consideration for the anatomical structures involved in airflow limitation. Option D, prioritizing exercises that strengthen the diaphragm and accessory breathing muscles, while carefully monitoring for signs of dyspnea and fatigue, and ensuring adequate rest periods. The correct answer is D, prioritizing exercises that strengthen the diaphragm and accessory breathing muscles, while carefully monitoring for signs of dyspnea and fatigue, and ensuring adequate rest periods. Explanation: scenario analysis. This scenario is professionally challenging because it requires the medical exercise specialist, MES, to interpret complex physiological data related to respiratory function and translate it into safe and effective exercise programming. The MES must consider the individual's unique anatomy and how it might be impacted by their medical condition, ensuring that exercise does not exacerbate their respiratory distress. This necessitates a deep understanding of the respiratory tract's anatomy and physiology, as well as the potential limitations imposed by specific pathologies. Correct approach analysis. The correct approach involves a thorough assessment of the client's respiratory anatomy and function, considering how their specific medical condition might affect these structures. This aligns with the MES's scope of practice, which mandates a client-centered approach based on evidence-informed practice and a comprehensive understanding of the individual's health status. By focusing on the anatomical structures of the respiratory tract and their functional implications, the MES can design an exercise program that is safe, effective, and tailored to the client's needs, thereby adhering to ethical principles of beneficence and non-maleficence. This approach is also consistent with the general principles of medical exercise, which emphasize understanding the underlying pathology and its impact on the body systems. Incorrect approach is analysis. One incorrect approach would be to solely focus on general cardiovascular fitness without considering the specific anatomical and functional limitations of the client's respiratory system. This fails to acknowledge the unique challenges presented by respiratory conditions and could lead to inappropriate exercise prescription, potentially causing harm. This approach neglects the foundational anatomical knowledge required for safe and effective medical exercise. Another incorrect approach would be to rely on generic exercise protocols for individuals with respiratory issues without a personalized assessment of their respiratory tract anatomy and function. This demonstrates a lack of due diligence and a failure to apply the principles of individualized exercise prescription, which is a cornerstone of medical exercise practice. It overlooks the critical need to understand how specific anatomical variations or pathological changes in the respiratory tract might influence exercise tolerance and safety. A further incorrect approach would be to delegate the assessment and programming related to respiratory function to another healthcare professional without direct involvement or understanding of the client's respiratory anatomy. While collaboration is important, the MES has a responsibility to understand the client's condition and how it impacts their ability to exercise, particularly concerning the respiratory system. This abdication of responsibility undermines the MES's role and expertise. Professional reasoning. Professionals should adopt a systematic approach that begins with a comprehensive client assessment, focusing on understanding the specific anatomical and physiological characteristics of the respiratory tract and how they are affected by the client's medical condition. This assessment should inform the development of an individualized exercise plan that prioritizes safety and efficacy. Continuous monitoring and reevaluation are crucial to adapt the program as needed. When faced with complex cases, consultation with other healthcare professionals is encouraged, but the MES must maintain a foundational understanding of the client's condition and its implications for exercise. Question 14. The control framework reveals that when a client with a history of asthma expresses interest in a novel breathing exercise technique purported to significantly enhance lung capacity, what is the most appropriate course of action for a medical exercise specialist? Option A. Advise the client that breathing exercises are generally beneficial for lung function and proceed with the new technique without further investigation, as the client is motivated. Option B. Immediately incorporate the new breathing technique into the client's program, assuming that any novel approach is likely beneficial and will improve lung function. Option C. Inform the client that their interest in unproven techniques is a distraction and focus solely on traditional cardiovascular and strength training exercises. Option D. Research the scientific evidence supporting the efficacy and safety of the specific breathing technique for individuals with asthma, and if evidence is lacking or inconclusive, recommend established, evidence-based respiratory exercise protocols. The correct answer is D. Research the scientific evidence supporting the efficacy and safety of the specific breathing technique for individuals with asthma, and if evidence is lacking or inconclusive, recommend established, evidence-based respiratory exercise protocols. Explanation. The control framework reveals that a medical exercise specialist, MES, must operate within the established scope of practice and adhere to evidence-based guidelines when advising clients on exercise. This scenario is professionally challenging because it requires the MES to balance the client's perceived benefits of a specific exercise modality with the established scientific understanding of its impact on lung function, particularly in the context of a pre-existing respiratory condition. Careful judgment is required to avoid making unsubstantiated claims or recommending interventions that could potentially be detrimental or ineffective, thereby upholding professional responsibility and client safety. The correct approach represents best professional practice because it prioritizes a thorough understanding of the scientific literature and the client's individual health status. By consulting peer-reviewed research and considering the client's specific pulmonary condition, the MES can provide evidence-based recommendations that are safe and effective. This aligns with the ethical obligation to act in the client's best interest and within the scope of practice for a medical exercise specialist, which emphasizes the application of exercise science to improve health outcomes for individuals with medical conditions. Adherence to these principles ensures that advice is grounded in scientific validity and client-specific needs, thereby maximizing potential benefits and minimizing risks. An incorrect approach that relies solely on anecdotal evidence or testimonials fails to meet the professional standard of care. This approach is ethically problematic as it prioritizes unverified claims over scientific evidence, potentially leading to the recommendation of ineffective or even harmful interventions. It also demonstrates a failure to adhere to the MES's responsibility to provide evidence-based guidance, which is a cornerstone of professional practice. Another incorrect approach that focuses on a single, unproven exercise technique without considering its specific impact on lung function in the context of the client's condition is also professionally unacceptable. This demonstrates a lack of critical evaluation and a failure to apply the principles of exercise physiology to a specific clinical population. It risks oversimplifying a complex physiological response and may lead to inappropriate recommendations that do not optimize pulmonary health. A further incorrect approach that dismisses the client's concerns about potential negative impacts without a thorough, evidence-based explanation is ethically deficient. While the MES must guide the client, doing so without addressing their specific anxieties and providing a reasoned, evidence-backed response undermines trust and the collaborative nature of the client-MES relationship. It fails to acknowledge the client's autonomy and right to informed decision-making. The professional reasoning framework that MES professionals should use involves a systematic process. First, thoroughly assessing the client's medical history and current condition, including any respiratory limitations. Second, critically evaluating the available scientific literature regarding the impact of proposed exercise modalities on lung function, specifically in populations with similar conditions. Third, integrating this evidence with the client's individual goals, preferences, and any reported concerns. Fourth, developing a personalized exercise plan that is safe, effective, and evidence-based, with clear communication and rationale provided to the client. Finally, ongoing monitoring and reassessment of the client's response to exercise are crucial for ensuring continued safety and efficacy. Question 15. The monitoring system demonstrates a sustained elevation in the client's heart rate response during a submaximal aerobic exercise bout, exceeding the predicted heart rate for the given workload by 15 beats per minute, with no reported subjective symptoms of distress. What is the most appropriate initial step for the medical exercise specialist to take? Option A. Increase the intensity of the exercise to see if the heart rate continues to rise, as this may indicate the client is adapting to the workload. Option B. Immediately contact the client's physician to report the elevated heart rate, requesting guidance on how to proceed with the exercise session. Option C. Assume the monitoring equipment is malfunctioning and disregard the elevated heart rate reading for the remainder of the session. Option D. Review the client's medical history, current medications, and the specific parameters of the exercise session, cross-referencing this information with the observed heart rate response to determine if it is within an acceptable individualized range or warrants further investigation. The correct answer is D. Review the client's medical history, current medications, and the specific parameters of the exercise session, cross-referencing this information with the observed heart rate response to determine if it is within an acceptable individualized range or warrants further investigation. Explanation. Scenario analysis. This scenario presents a common challenge for medical exercise specialists, MES, where objective data from a monitoring system indicates a potential deviation from expected cardiovascular responses to exercise. The challenge lies in interpreting this data accurately within the context of the client's overall health status and the established exercise prescription, while adhering strictly to the MES scope of practice and relevant regulatory guidelines. Misinterpretation could lead to inappropriate exercise modifications, potentially compromising client safety or efficacy of the program. The MES must exercise sound professional judgment, balancing the data with clinical knowledge and client-specific factors. Correct approach analysis. The correct approach involves a systematic review of the client's medical history, current medications, and the specific exercise session parameters that generated the monitoring system data. This aligns with best professional practice by ensuring that any intervention is evidence-based and client-centered. Regulatory frameworks for MES typically emphasize the importance of individualized programming and ongoing client assessment. By cross-referencing the monitoring data with the client's baseline and known physiological responses, the MES can determine if the observed changes are within an acceptable range for that individual, or if they warrant further investigation or modification. This approach upholds ethical obligations to provide safe and effective care, ensuring that exercise interventions are tailored to the client's unique needs and responses, thereby maximizing benefits and minimizing risks. Incorrect approaches analysis. One incorrect approach involves immediately escalating the situation to a physician without first conducting a thorough internal assessment. This bypasses the MES's professional responsibility to analyze the data and apply their expertise. Regulatory guidelines for MES define their scope of practice, which includes assessment and modification of exercise programs within their competency. Unnecessary escalation can be inefficient and may indicate a lack of confidence in their own diagnostic and analytical skills, potentially violating the principle of providing appropriate and timely care. Another incorrect approach is to disregard the monitoring system data entirely, attributing it to equipment malfunction without any further investigation. This failure to acknowledge and analyze objective data is a significant professional and ethical lapse. Regulatory frameworks mandate that MES utilize available tools and information to inform their practice. Ignoring such data could lead to missed opportunities to identify critical changes in a client's cardiovascular status, potentially resulting in adverse events and a breach of the duty of care. A third incorrect approach is to make significant, unverified changes to the exercise prescription solely based on a single data point from the monitoring system, without considering the client's subjective experience or other physiological indicators. This reactive and uncritical application of data can be dangerous. Professional practice requires a holistic assessment, integrating multiple data points and client feedback before altering an established program. Such an approach could lead to overexertion or underexertion, compromising the client's safety and the effectiveness of the prescribed exercise. Professional reasoning. When faced with unexpected data from a monitoring system, MES professionals should employ a structured decision-making process. This begins with a thorough review of the client's comprehensive medical profile, including their condition, medications, and previous exercise responses. Next, the specific parameters of the exercise session that generated the data should be examined, considering intensity, duration, and environmental factors. The monitoring data should then be critically analyzed in conjunction with the client's subjective feedback, e.g., perceived exertion, symptoms, and other objective measures, e.g., heart rate, blood pressure if taken. If the data suggests a significant deviation from the expected or safe response, and the MES has the expertise to interpret it within their scope of practice, they should consider appropriate modifications to the exercise prescription. If the data is unclear, concerning, or falls outside the MES's scope of expertise, the next step is to consult with the client's physician or referring healthcare provider, providing them with all relevant objective and subjective information. This systematic, evidence-based, and client-centered approach ensures that decisions are safe, effective, and compliant with professional standards and regulatory requirements. Question 16. Cost-benefit analysis shows that a client seeking rapid weight loss and improved cardiovascular endurance is primarily focused on maximizing immediate caloric expenditure during exercise sessions. Considering the distinct roles of the phosphagen, glycolytic, and oxidative energy systems in exercise performance and adaptation, which approach best balances the client's immediate goals with the physiological principles of energy system development and long-term health within the MES regulatory framework. Option A. Focusing solely on long-duration, low-intensity aerobic activities to ensure consistent caloric expenditure without risking overexertion. Option B. Prioritizing exercises that heavily tax the phosphagen system, such as maximal sprints and power lifts, to build explosive strength and immediate energy availability. Option C. Designing all training sessions to be exclusively high-intensity interval training, HIIT, to maximize the anaerobic contribution and caloric burn in the shortest possible time. Option D. Implementing a progressive training program that strategically incorporates varying intensities and durations of exercise to systematically challenge and enhance the capacity of each energy system, prioritizing adequate recovery between sessions. The correct answer is D. Implementing a progressive training program that strategically incorporates varying intensities and durations of exercise to systematically challenge and enhance the capacity of each energy system, prioritizing adequate recovery between sessions. Explanation. This scenario presents a professional challenge because it requires the medical exercise specialist, MES, to balance the client's immediate desire for rapid progress with the fundamental physiological principles of energy system development and the ethical imperative to prioritize client safety and long-term health. The MES must understand that different exercise intensities and durations preferentially recruit specific energy systems, and attempting to bypass or accelerate this natural adaptation process can lead to overtraining, injury, and diminished long-term gains. The regulatory framework for MES, which emphasizes evidence-based practice and client well-being, underpins the need for a nuanced approach. The correct approach represents best professional practice because it aligns with the principles of progressive overload and periodization, which are foundational to exercise physiology and recognized within the MES scope of practice. By gradually increasing exercise intensity and duration, the MES allows for the systematic adaptation of the phosphagen, glycolytic, and oxidative energy systems. This approach minimizes the risk of injury, promotes sustainable fitness gains, and adheres to the ethical guidelines that mandate the MES to act in the best interest of the client, ensuring their safety and promoting their overall health. This aligns with the regulatory expectation that MES practice is grounded in scientific evidence and client-centered care. An incorrect approach that focuses solely on maximizing immediate caloric expenditure without considering the underlying energy system demands would be professionally unacceptable. This fails to acknowledge the physiological limitations of each energy system and the time required for their adaptation. Such an approach could lead to excessive reliance on anaerobic pathways for prolonged activities, resulting in premature fatigue, potential rhabdomyolysis, and a failure to develop the aerobic capacity necessary for sustained performance and recovery. This violates the ethical duty of care and the regulatory requirement for competent practice. Another incorrect approach that prioritizes solely high-intensity interval training, HIIT, without adequate recovery or a structured progression would also be problematic. While HIIT is effective for certain adaptations, its indiscriminate application, especially without considering the client's current fitness level and the capacity of their energy systems to recover, can lead to overtraining syndrome, burnout, and increased susceptibility to injury. This disregards the principle of individualization and the need for a balanced training program that respects the body's recovery mechanisms, which is a cornerstone of ethical and regulatory compliance for MES. A third incorrect approach that neglects the development of the oxidative system in favor of exclusively focusing on anaerobic power would be detrimental. While explosive power is important, a well-rounded fitness program requires a robust aerobic base for efficient energy production, recovery, and overall health. Failing to develop the oxidative system limits the client's capacity for sustained effort and their ability to recover effectively between high-intensity bouts, ultimately hindering long-term progress and potentially impacting cardiovascular health. This represents a failure to provide comprehensive and evidence-based exercise programming. The professional decision-making process for similar situations should involve a thorough client assessment, including understanding their goals, current fitness level, and any pre-existing conditions. The MES must then apply their knowledge of exercise physiology to design a program that systematically addresses the development of all relevant energy systems, incorporating principles of progressive overload, periodization, and adequate recovery. Continuous monitoring of the client's response to training, coupled with open communication, is crucial for making necessary adjustments and ensuring the program remains safe, effective, and aligned with the client's long-term health objectives, all within the established regulatory and ethical boundaries of the MES profession. Question 17. The assessment process reveals a client with a diagnosed history of osteopenia, exhibiting mild vertebral compression fractures in the past year. The client expresses a desire to improve overall strength and reduce the risk of future falls. Considering the client's bone structure and function, which of the following exercise programming approaches would be most appropriate and safe for this individual? Option A. Implement a progressive program that includes moderate-intensity weight-bearing exercises, controlled resistance training focusing on major muscle groups, and specific balance and proprioception drills, with careful monitoring for any signs of discomfort or instability. Option B. Recommend a program consisting solely of low-impact aerobic activities like swimming and cycling, with no emphasis on resistance or balance training, to minimize any potential stress on the vertebral column. Option C. Design a high-intensity interval training (HIIT) program incorporating plyometric exercises and heavy lifting to maximize bone stimulation and rapid strength gains. Option D. Focus exclusively on flexibility exercises and gentle stretching, as any form of resistance or weight-bearing activity could exacerbate bone loss and increase fracture risk. The correct answer is A. Implement a progressive program that includes moderate-intensity weight-bearing exercises, controlled resistance training focusing on major muscle groups, and specific balance and proprioception drills, with careful monitoring for any signs of discomfort or instability. Explanation. The assessment process reveals a client with a history of osteoporosis, presenting a common yet complex challenge for a medical exercise specialist, MES. The primary challenge lies in balancing the need for exercise to promote bone health and prevent further loss with the inherent risk of fractures due to compromised bone structure. Careful judgment is required to select appropriate exercises that stimulate bone remodeling without exceeding the client's tolerance. This necessitates a deep understanding of bone physiology, biomechanics, and the specific contraindications and precautions associated with osteoporotic bone. The correct approach represents best professional practice because it prioritizes client safety and evidence-based interventions, aligning with the core ethical and professional responsibilities of an MES. Specifically, it involves a comprehensive assessment of the client's current bone density, fracture history, and functional limitations. Based on this, the MES designs a progressive exercise program that incorporates weight-bearing activities, resistance training, and balance exercises, all within the client's safe limits. This approach is directly supported by the principles of exercise prescription for individuals with osteoporosis, aiming to improve bone mineral density and reduce fall risk, thereby mitigating the likelihood of fractures. Adherence to established guidelines for exercise in osteoporosis is paramount, ensuring that interventions are both effective and safe. An incorrect approach that focuses solely on high-impact, high-intensity exercises without considering the client's bone fragility would represent a significant regulatory and ethical failure. Such an approach disregards the fundamental principle of do no harm and could lead to serious injury, including fractures, which would violate the MES's duty of care. Another incorrect approach might involve neglecting to incorporate balance and proprioception training, which are critical for fall prevention in individuals with osteoporosis. This omission would be professionally unacceptable as it fails to address a key risk factor for fractures and falls, thereby not providing a holistic and safe exercise prescription. Furthermore, failing to document the assessment findings, exercise plan, and client progress would be a breach of professional record-keeping standards, potentially hindering future care and accountability. The professional reasoning framework for similar situations involves a systematic process. 1. Thorough client assessment, including medical history, current condition, and functional capacity. 2. Identification of risks and contraindications specific to the client's condition. 3. Evidence-based exercise selection and progression, prioritizing safety and efficacy. 4. Continuous monitoring and adaptation of the exercise program based on client response. 5. Clear and accurate documentation of all aspects of the client's care. This framework ensures that the MES acts within their scope of practice, adheres to ethical principles, and provides the highest standard of care. Question 18. The monitoring system demonstrates that a client, who is 6 weeks post-operative fixation of a tibial plateau fracture, reports feeling much better and expresses a strong desire to resume their previous high-impact training regimen. Radiographic imaging from the referring orthopedic surgeon indicates early callus formation but no complete bony union. The physician's initial post-operative orders permit gradual weight-bearing as tolerated and gentle range of motion exercises, with a follow-up appointment scheduled in 4 weeks. Which of the following approaches best aligns with the medical exercise specialist's scope of practice and ethical responsibilities in this situation? Option A. Design a personalized exercise plan that focuses on cardiovascular conditioning and upper body strength, completely avoiding any lower body exercises until the physician explicitly clears them for full weight bearing and impact. Option B. Implement a progressive exercise program that gradually increases load and complexity, focusing on proprioception and controlled strengthening, while strictly adhering to the physician's current limitations and seeking further medical clearance before introducing any high-impact activities. Option C. Advise the client to cease all exercise until the next physician appointment, as the fracture is not yet radiographically healed, to avoid any potential risk of re-injury. Option D. Immediately initiate a high-intensity training program that includes plyometrics and agility drills, as the client reports feeling ready and expresses a strong desire to return to their previous activity level. The correct answer is B. Implement a progressive exercise program that gradually increases load and complexity, focusing on proprioception and controlled strengthening, while strictly adhering to the physician's current limitations and seeking further medical clearance before introducing any high-impact activities. Explanation. Scenario analysis. This scenario presents a professional challenge due to the inherent variability in fracture healing and the potential for re-injury. A medical exercise specialist, MES, must balance the client's desire for functional recovery with the physiological realities of bone repair, adhering strictly to established medical protocols and the scope of practice. The risk of overexertion or inappropriate exercise can lead to delayed healing, malunion, or refracture, necessitating a cautious and evidence-based approach. Correct approach analysis. The correct approach emphasizes a phased progression based on objective clinical indicators of healing, such as radiographic evidence and the absence of pain or instability during functional movements. This aligns with best professional practice by prioritizing client safety and evidence-based rehabilitation. Regulatory frameworks for MES typically mandate working within their scope of practice, which includes understanding contraindications and contratherapeutic exercises and collaborating with the referring physician. This approach ensures that exercise interventions are medically appropriate and do not compromise the healing process, thereby upholding ethical and regulatory standards. Incorrect approaches analysis. One incorrect approach involves proceeding with a high-intensity exercise program solely based on the client's subjective report of feeling ready or a predetermined timeline without objective medical clearance. This fails to acknowledge the physiological stages of bone healing and the potential for asymptomatic instability or incomplete callus formation. Ethically, this constitutes a breach of duty of care, as it places the client at undue risk of re-injury. Regulationally, it may exceed the MES scope of practice by making independent medical judgments about healing status. Another incorrect approach is to cease all exercise interventions indefinitely until complete radiographic union is confirmed, even if the client experiences minimal pain and has been cleared for gradual weight bearing. This approach is overly conservative and can lead to deconditioning, muscle atrophy, and joint stiffness, negatively impacting functional outcomes. It fails to leverage the benefits of controlled, progressive exercise in promoting circulation and stimulating bone remodeling, which are crucial for optimal recovery. This can be considered a failure to provide appropriate care within the MES's expertise. A third incorrect approach is to implement exercises that mimic the demands of the fracture site without specific physician guidance or objective assessment of healing progression. For example, attempting to load a healing tibia fracture with plyometric exercises before adequate bone consolidation is evident. This disregards the critical need for physician oversight and a phased approach to rehabilitation, potentially leading to catastrophic re-injury and violating the principle of do no harm. Professional reasoning. Professionals should employ a decision-making framework that begins with a thorough understanding of the specific fracture type, location, and the client's overall health status. This is followed by obtaining clear medical clearance and specific exercise guidelines from the referring physician. The MES must then continuously monitor the client's response to exercise, utilizing objective measures of pain, swelling, range of motion, and functional capacity. Progression should be gradual and guided by the client's healing progress, not solely by a calendar. Regular communication with the physician is paramount, especially if any concerns arise regarding the healing process or the client's response to exercise. This systematic, collaborative, and client-centered approach ensures safe and effective rehabilitation within the MES's professional boundaries. Question 19. The performance metrics show a client's heart rate is within the prescribed aerobic training zone and their oxygen saturation remains stable, yet the client reports feeling significantly fatigued and unable to continue the current intensity of the exercise. Which of the following approaches best reflects a medically appropriate and ethically sound response for a medical exercise specialist? Option A. Immediately reduce exercise intensity and duration, and inquire about other potential contributing factors to fatigue such as sleep quality, nutrition, and stress levels. Option B. Terminate the exercise session immediately and schedule a follow-up assessment to investigate potential underlying medical issues. Option C. Increase the exercise intensity slightly to push through the perceived fatigue, assuming it is a temporary psychological barrier. Option D. Continue the exercise at the prescribed intensity, explaining to the client that their objective physiological data indicates they are capable of continuing. The correct answer is A. Immediately reduce exercise intensity and duration, and inquire about other potential contributing factors to fatigue such as sleep quality, nutrition, and stress levels. Explanation. Scenario analysis. This scenario presents a common challenge for a medical exercise specialist, MES, where objective performance data, heart rate, perceived exertion, appears to contradict the client's subjective experience of fatigue. The MES must reconcile these discrepancies to ensure client safety, optimize training, and maintain client trust, all while adhering to professional standards of care. The challenge lies in interpreting the interplay of different energy systems and their impact on perceived exertion versus physiological markers. Correct approach analysis. The correct approach involves a comprehensive assessment that considers the client's subjective feedback alongside objective data. This aligns with best professional practice by prioritizing client safety and individual response to exercise. It acknowledges that while physiological markers provide valuable information, perceived exertion is a critical indicator of fatigue and potential overexertion, especially in individuals with medical conditions. Regulatory frameworks for MES typically emphasize individualized programming and client-centered care, requiring the professional to adapt interventions based on the client's unique presentation. This approach respects the client's autonomy and experience, fostering a collaborative relationship. Incorrect approaches analysis. One incorrect approach would be to solely rely on the objective heart rate data and disregard the client's reported fatigue. This fails to acknowledge the complex nature of energy system utilization and its subjective manifestation. It could lead to overtraining, increased risk of injury, and a breakdown in the client-professional relationship, potentially violating ethical guidelines related to client well-being and informed consent. Another incorrect approach would be to immediately cease exercise based solely on perceived exertion without further investigation. Caution is important. This might be an overreaction if the objective data suggests the exercise is within safe physiological limits and the fatigue is transient or related to factors outside the immediate exercise bout. This approach lacks a nuanced understanding of energy system recovery and adaptation. A third incorrect approach would be to attribute the discrepancy solely to a cardiovascular limitation, without considering other contributing factors to fatigue, such as neuromuscular fatigue, metabolic byproducts, or even psychological factors. This oversimplification ignores the integrated nature of the body's response to exercise and the interplay of aerobic and anaerobic energy systems. Professional reasoning. When faced with conflicting data, a professional MES should employ a systematic decision-making process. This involves 1. Actively listening to and validating the client's subjective experience. 2. Reviewing objective data in the context of the client's medical history, current condition, and training status. 3. Considering the likely energy systems being utilized during the exercise and how they might contribute to both objective and subjective findings. 4. Implementing a brief targeted assessment to gather more information, e.g., asking about sleep, nutrition, stress, or performing a brief functional movement screen. 5. Making an informed decision to modify the intensity, duration, or type of exercise, or to terminate the session if safety is compromised, always communicating the rationale to the client. Question 20. Assessment of a client's progress after 8 weeks of a consistent resistance training program designed to improve muscular strength and endurance, considering the typical timelines for various physiological adaptations to chronic exercise. Option A. Evaluating the client's ability to perform more repetitions at the same resistance or increase the resistance for the same number of repetitions, while also noting any subjective improvements in perceived exertion and recovery. Option B. Immediately increasing the training volume by 50% and introducing advanced plyometric exercises to accelerate strength gains. Option C. Maintaining the exact same training program without any modifications, assuming that the initial program is sufficient for continued adaptation. Option D. Focusing solely on the client's self-reported feeling of fatigue, disregarding objective measures of strength and endurance. The correct answer is A. Evaluating the client's ability to perform more repetitions at the same resistance or increase the resistance for the same number of repetitions, while also noting any subjective improvements in perceived exertion and recovery. Explanation. This scenario is professionally challenging because it requires the medical exercise specialist, MES, to balance the client's desire for rapid progress with the physiological realities of chronic exercise adaptations. Overlooking the nuanced timeline of these adaptations can lead to inadequate programming, client dissatisfaction, or, more critically, adverse health events. The MES must possess a deep understanding of how the body responds to consistent training stimuli over time, recognizing that significant physiological changes are not instantaneous but develop progressively. The correct approach represents best professional practice because it aligns with the fundamental principles of exercise physiology and the ethical responsibility of an MES to prioritize client safety and efficacy. By systematically assessing and adjusting the program based on the client's individual response to chronic exercise, the MES ensures that the training stimulus remains appropriate for the current adaptation stage. This iterative process, informed by evidence-based practice and a thorough understanding of physiological adaptation timelines, e.g., neuromuscular adaptations occurring earlier than significant hypertrophic or cardiovascular changes, allows for optimal progression and minimizes the risk of overtraining or injury. This adheres to the MES scope of practice, which mandates individualized programming and ongoing client monitoring. An incorrect approach that focuses solely on increasing intensity or volume, without considering the client's current adaptive state, fails to acknowledge the principle of progressive overload in a safe and effective manner. This could lead to a plateau in progress or, worse, an increased risk of injury, violating the ethical duty to provide competent and safe care. Another incorrect approach that relies on generic, non-individualized exercise prescriptions disregards the core tenet of personalized medicine and exercise programming, which is central to the MES role. This failure to tailor the program to the client's specific needs and responses is a direct contravention of professional standards and ethical obligations. A further incorrect approach that prioritizes client perception of progress over objective physiological markers risks overlooking subtle but important signs of overreaching or inadequate adaptation, potentially leading to detrimental outcomes. Professional decision-making in similar situations requires a systematic approach. 1. Thoroughly assess the client's baseline status and goals. 2. Develop an individualized exercise program that considers the expected timeline of physiological adaptations. 3. Continuously monitor the client's response to exercise, both subjectively and objectively. 4. Periodically reassess the client's progress and adjust the program based on their current adaptive state and the principles of progressive overload. 5. Maintain open communication with the client regarding expectations and progress.